Alright, so let us begin with today's session on Allen's keynotes and two important remedies that we will be studying. One is ammonium carb and another is ammonium mure. So both are ammonium compounds and they vary a little bit in their sphere of action and how they act on the human physiology and how they act in the diseases. So ammonium carb, the first thing that we read from Allen's keynotes is that it is suited to people who are stout, fleshy women with various troubles in consequence of leading a sedentary life. It also suits people, women who are delicate women who must have the smelling bottle at hand and readily catch the cold in winter season. So you have all those women who always have to sniff, always have to carry some inhalers, or they also need to puff the you know the nebulizers or something like that. All those cases will require ammonium carb. If they have complained of that, very frequently it will be indicated. The main sphere of action coming next to ammonium carbs explanation is that it is suited to hemorrhagic diathesis. Wherever there is bleeding in the body from any orifice or there is seeming to be accumulation of lot of blood which is disorganized, not it shouldn't be there at that moment but it is present there because of some inflammatory process that is going on inside. Think about ammonium carb. The fluid blood is there, there is degeneration of red blood corpuscles and ulcerations which tend to gangrene. In these conditions you can think of ammonium carb. Next you have is something about the children who dislike to be washed, like we see in antimcrude and sulfur. There is ill humor during wet and stormy weather. So this is one of the chief indications for ammonium carb. It is indicated in such weather where there is dampness, wetness, and people have troubles. Almost everything aggravates for them in this season. Then you have panaricium, which is kind of a pain running from the nail because of some inflammation or infection, and also it is suited to deep-seated periosteal pain, like the remedies Dioscorea and silica. Body is red as if there is scarlatina. You have to compare this with ailanthus. Once upon a time, our masters have cured lot of cases of diphtheria and scarlatina fever using ailanthus and ammonium carb. If you go to the history, you will find that these remedies were most valuable amongst all the remedies which we have. Headache, sensation of fullness as if forehead would burst. Belladonna and Glonoine are the other remedies. Nosebleed when washing the face. Arnica and Macab are on par with the ammonium carb. And also there is nosebleed when the patient washes the hands in the morning or especially from the left nostril after eating, or it is also after eating. So those patients who always complain of epistaxis, but over here you will see that very less it would be indicated for epistaxis or nasal bleed due to polyps. It will be mostly related to the engorged bones around the facial region, which should be thought of where you should think of ammonium carb rather than in polyps where you can think of other remedies like phosphorus, L3 carb, TPM, myromerin. Oziana, which is a bad breath or bad smell from the nose, blowing bloody mucus from the nose frequently, blood rushes to the tip of the nose when stooping. So there is an aggravation from stooping. As soon as the patient bends forward, the blood easily flows out, and it is actually very easy to find out that this patient requires ammonium carb. Stoppage of nose mostly at night. This is one of the indications, like nux vomica we have seen, which has nux mosciata also, nux vomica also, which have aggravation of nasal obstruction mostly at night. Think of ammonium carb also. Must breathe through the mouth and this is a concomitant symptom, I would say, in all the cases of throat complaints or any bodily pains complaints, where you can think of ammonium carb based upon this concomitant symptom that the nose is blocked in the night. So I have been speaking about bringing together the different components of remedies together, and whenever you will have cases of deep pathologies, whenever you will have cases where you will need to think that uh, how will you analyze, how will you bring together the totality, just bring the components together, whatever is affecting the blood or whatever is affecting the respiration, and there is one concomitant symptom which is a strong symptom in the anywhere in the body, pain in the legs, pain in the head, or it can be this topic of the nose at night, like in this case ammonium carb. You can think of ammonium carb in such a case. Putrid sore throat, tendency to gangrenous ulceration of tonsils, glands are engorged. In diphtheria or scarlatina, where the nose is stopped up, child cannot sleep because it cannot get its breath. Dyspnea with palpitation, worse by exertion or on ascending even a few steps, worse in a warm room. So all the ammonium carb patients will be, number one, aggravated by wet weather, cold weather, damp weather. Number two, they will be aggravated by warm room, and there will be a very strong relation of the heart with the blood circulation. So if you go to different books, for example, if you go to Boger Synoptic Key or Bird Physiology or any other book which is giving you the sphere of action of ammonium carb, you will see that it acts on heart, especially the circulation, the blood, and it will also act on the respiratory system. It will act in the lungs and the bronchi, as well as the circulation and the blood component specifically. And that's what makes this remedy unique, because in all those cases which have a compensatory action of disease on both the parts, which is the heart and the respiratory, and both are kind of connected. In those cases you can think of ammonium carb. One of the best remedies in emphysema, which is where this trouble is mostly looking like partly in the or 80% in the chest, and then the other part is in the circulation. Cough in ammonium carb is dry tickling in the throat as from dust every morning from 3 to 4 am, which is very similar to Kali carb. Kali carb will have better by bending forward, aggravated by lying down. Ammonium carb may probably also have symptom where as soon as they lie down they feel suffocated as when they lie down or go in sleeping or lying position, and there will be stoppage of nose, which is a concomitant runs through the entire remedy through and through. So Grindelia and Lachesis are very close to this symptom, where the patient goes to sleep or tries to feel that there is suffocation as soon as he goes to sleep, and he will lose breath. Then you have cholera-like symptoms at the commencement of menstruation. Bovista and Veratrum are the other two remedies, which are having diarrhea or gastric disturbance before or during menstruation. You will see that we have so far in so many days studied magnesium group, laccan group, which will have trouble in the breasts before, during or after menses. There will be remedies which will have trouble in the gastric sphere, like ammonium carb, like Bovista, like Veratrum, in the gastric sphere before, during or after menses. So in this way you can categorize remedies based upon what is the sphere of action before, during or after menses, and this can be a valuable guide for prescribing this remedy, because otherwise it is very difficult to come to a constitutional understanding of ammonium carb and ammonium mure, because these two remedies have symptoms and rubrics of the mind, but to decipher them and to understand them from the clinic, from the patient's perspective, is difficult. And that is why you can rely more on the physical generals, physical particulars, which will give you more better understanding, and these will be the more commonly observed symptoms in the patient, rather than the mind symptom which will only have the feeling of embitteredness. So ammonium carb, if you go and study all the different literatures from the mind aspect, you will see that there is a mention that there is an embittered feeling. What is this embittered feeling? It is nothing but a kind of a grudge that they hold towards that person. This will be the only thing which is available in most of the ammonium patients, and this actually comes from the ammonia component. And if you see the doctrine of signature of ammonia, you will see that it has a very bad odor which kind of repels people, So in this way, this doctrine of signature gives its impression on the mind, and it gives an impression on the patient in their symptoms, in their life around them. This will be the only key symptom, key mind symptom which will be available. Based upon this, they will probably experience betrayal. They will tell you that that person did bad to me, that person did wrong to me, I feel so bad, I feel so wrong. This also classifies more like nausea, but based upon physical particulars and physical generals, you will be able to prescribe ammonium carb. Otherwise, it is difficult to come to this remedy like a classical polygress remedy which has fear of dark or fear of ghost, or someone has standing behind like in Medorinum, or fear of dark which is there in phosphorus, calcarea, etc. Or there is kind of undertaking things opposed to in sepia. This is all classical things which we see in sepia and other polycrest remedies. But for ammonium carb, it will be just this embittered feeling. They have the grudge from some person, they hold it, they feel bad, they feel all the other series of emotions which naturally a human feels. We classify them into rubrics and may be misled, but based upon physical particulars and physical generals, one physical general which you saw was diarrhea-like symptoms or cholera-like symptoms before or at the commencement of menstruation, other remedies being Bovista and Varatrum. Next you have is menses too early, profuse, preceded by griping colic. Acrid makes the thighs sore, copious at night and when sitting. The other remedy being Zincum metallicum, with toothache, colic, sadness, fatigue, especially of thighs, yawning and chilliness. Next you have leucorrhea, which is watery, burning from the uterus, acrid, profuse from the vagina and excoriation of vulva. So you have this interesting phenomena of acridity which you see all through the remedy across the different symptoms, different discharges. You will come across patient who will complain of such discharges or excretions throughout the body happening. Think of giving ammonium carb based upon these indications. Then you have something about the skin which is malignant scarlatina with deep sleep, stertorous breathing, miliary rash, faintly developed eruption from defective vitality, threatened paralysis of the brain. Tuberculinum and zincum are the other two remedies. Next we come to is modalities. Cold and wet weather aggravates. Wet poultices from washing during menses aggravates. Amelioration from lying down on the abdomen, like in the case of acetic acid, or lying on the painful side in dry weather is also amelioration for ammonium carb. Ammonium carb antidotes rust stalks and stings of insects, and it affects the right side most. And there is a very beautiful line mentioned that it is inimical to lachesis, so it kind of runs parallels in its action to lachesis. Lachesis also causes similar phenomena. It's a hemorrhagic remedy. It causes disorganization of blood and has many symptoms similar to ammonium carb. That is why it is kind of an inimical. So that's the end of ammonium carb. It acts on the heart, it acts on the blood components specifically, and also the circulation and the respiratory organs, especially the lungs and the bronchi. Next we come to is ammonium carb, the next remedy, which has a specific and exclusive action on the mucous membranes of the chest and the gall ducts. Okay, so we see that there is a mention that it is adapted to those who are flat, sluggish, or body is large and fat but legs are too thin. So all those cases which we seem to be like opposite of LICO. Opposite of LICO means that in LICO we had upper body emaciated and lower part is dropsical or kind of too large. And here we see the legs are too thin and the body is too large. So all those women who kind of are obese, lead a sedentary life, but they taper down at the bottom. In the legs they are very thin. In those cases we can think of ammonium carb. Ammonium carb also acts on the blood like ammonium. Ammonium mure also acts on the blood like ammonium carb, and it also acts on the liver. And a special action we see of ammonium mure is on the spot between the scapulae and the tips of the fingers and toes. So I extracted this specifically from Boger Synoptic because otherwise in the Allen's keynotes you will be confused by prescribing these interesting remedies which are less prescribed. And it is important to study the remedy from the physical general's point of view, from the physical particulars, and from the sphere of action. See, if you are studying the remedy from mind symptoms, there is bound to be interpretation, and this interpretation will depend on how much is your knowledge about mind, about psychology, about mind chapters, and the different human psychology. But when you study it from the physical particulars, from sphere of action, from physical generals, you can't change it because it's there. It's exactly how it has to be, and there is no interpretation. You can't change it. You can't change modalities. That's the beauty of relying on these things and rather than on mind mostly, because it's going to be very easy for you to practice, and this is the way it should be for 80% of our cases, or even if not 80, it should be more so for 70% of cases or 60-70% of cases. So next we have in ammonium mure, after the constitution of legs are thin and body is fat, we have offensive sweat of the feet, alumina, graphitis, sorinum, sanguinea, silica. All the remedies that we studied had these symptoms. Ammonium mure is one of them. Don't try to miss it. If you have a patient who enters with a foul and bad smell in the clinic, think of ammonium mure also as one of the differential remedies if your physical generals and physical particulars agree. Otherwise you can think of sorinum, silica, graphitis, etc. Next we have is respiratory system, watery, acrid coryza corroding the lip, Allium cepa. So acidity of discharges, if you see in both the remedies, runs through commonly. And if you have a patient who have acrid discharges from the nose, from the gastric mucosa, there is acrid eructations, acidity, heartburn, there is offensive foot smell. So all these, if you trace back, it goes back to ammonia, which is the source of these remedies, and then you establish a correlation and you will be in a better position to prescribe. Next you have is gastrointestinal system, which is obstinate constipation accompanied by much flatus. Hard crumbling stools require great effort in expulsion, crumble at the verge of anus. We saw this also in MAG-mure. So the interesting thing about MAG-mure and ammonium mure as a comparison is that it has this kind of a stool which will partly expel and partly come back, and they will also have this kind of what do you see is this during menses diarrhea, or during menses there is profuse flow at the night, which is very interesting. And from the physical generals, if you confirm from the patient that the menses are mostly at night, you should directly think of remedies which have this predisposition or this way of action, and it will open up your doors to prescribe the remedy from the physical generals rather than thinking about the remedies from the mind section. Next you have is the stools are not alike or not same. Every stools will change in its nature or color, like the remedy pulsatilla. So ammonium mure also has that. And then ammonium mure has hemorrhoids, which are sore and smarting with burning, stinging in the rectum for hours after the stools. Aesculus and sulfur are the other two remedies which should be indicated in such cases. Ammonium mure is one of them. And if it happens after suppression of leukorrhea, you should think of ammonium mure. Then we come to female reproductive system, which has the symptoms of leukorrhea like white of egg, preceded by griping pain about the navel, brown, slimy, painless after every urination. During menses, as we saw in ammonium carb, ammonium mure also has diarrhea and gastric symptoms, especially vomiting. Bloody discharge from the bowels, which is similar to phosphorus, but the interesting thing is that the flow is most profuse at the night, which is also the case with magnesium. And there are neuralgic pains in the feet of ammonium carb, and profuse flow at night is also there in Bovista. If the flow is as soon as they lie down, it is creosote. So you can make your own chart of remedies for prescribing on this basis, and maybe it will give you good success if you stick to these pointers. Next, you have one symptom which is very peculiar, and Dr. S.R. Phatak cured one of the patients who had this typical symptom of in a case of fever, which is sensation of coldness in the back between scapulae. Lacnanthus is another medicine. Hamstrings feel painfully short when walking. Tension in the joints as from shortening of the muscles. Causticum and Cimex are the other two remedies. And last but not the least, the relationship of ammonium mure. It is antimony crude, phosphorus, pulsatilla and sanicula. So we covered two interesting remedies, ammonium carb and ammonium mure. Ammonium carb has action on the circulation and blood and lungs and the bronchi for the respiratory system. Ammonium mure has action on the mucous membranes of the chest and also the respiratory tract and also the gastric tract, especially the liver also, and it acts on the tips of the fingers and the toes and also a bit on the gastric mucosa that we see. So that's all for today's session. It was short and concise. I hope to see you all tomorrow evening again 5 p.m. with another set of remedies, and continue this Allen's Keynote study streak to finish all the remedies from Allen's Keynotes. Meanwhile, if anyone has any questions, please feel free to ask about anything related to your cases or materia medica, repertory or prescription or potency. So if anyone has any questions, please feel free to answer or comment in the comment box below. Otherwise, we'll call it a day. And if anyone would like to avail the recordings of my previous workshops, which is case taking workshop, rubric workshop, kingdom differentiation workshop, all the details are already posted on the timeline of Instagram, Facebook and also YouTube. You can go through it and get access by contacting the number mentioned. And also there is an upcoming workshop on fevers. How will you take a case? How will you analyze the different cases using a case taking pro forma? What will be the remedies you should think of? Their materia medica, their repertorizations, their rubrics and clinical cases before after that you should know of. And study the fevers through that aspect. So we'll cover all this in the future upcoming workshop, which is the fever workshop. You can contact us on the number to get access, and that's all for today.